Hello everyone, once again welcome to my Oet channel. Today's video we will just discuss regarding one role play card in which the scenario is accident and emergency department, and we are going to discuss the discharge plan of a 4-year-old girl to her mother. So this is a second degree talk. So second degree talk means we are talking to the parent or a relative, not to the patient directly, and they have mentioned that baby is not with the scenario, I mean in the scenario. So in this type of case note, we have to concentrate on the interaction. Actually, if you see the role play card, you can come to know that it is starting with the confirm. So in most of the role play card, if it is comes confirm, we will have confusion how we have to start, whether it is a non scenario or unknown scenario. And of course, if it is a discharge scenario, if we are going to discuss regarding the discharge plan, means of course it will be a non scenario, because from morning you are with the patient and you are interacting with them, and of course after the doctor's round, they used to take decision for discharge, and you are going to discuss the plan. So most probably it will be a non-case, but according to the role play card it can vary, but 85% I can tell you that almost all discharge role plays are discharge plan discussion. If the heading is like that, means it will be a non-scenario. There actually no need for self-introduction and no need to ask patients their name also during the role play, but during the 3-minute preparation time you have to ask the interlocutor how may I address you, and if the scenario is related to baby and mother, you have to ask how may I address you and what is your baby's name. Like that also you can ask, and you can write it in the role play card. And another one, what I told you is confirm. If it is starting with the confirm, means how we can start. Just you can start like a good morning. Example, that mother's name is Maria, means good morning Maria, how are you feeling your baby? Or if it is to the patient, means how are you feeling today? And actually I came here for discussing regarding your discharge plan, and whether your doctor told you regarding your discharge decision. Like that we can ask the question. If it is mother, means we can ask that, as Maria, do you know your baby is getting discharged today? Your baby's doctor has informed you, isn't it? Like that we can confirm, like we are asking and we are getting confirmation from the patient or the relative. So this is just I want to tell you regarding confirmation, because most of the students, they are getting confusion how to start the role play if the task is starting with confirm. Okay, so this is the way you have to start, and we will go to the role play card. And this is, as I told you, this is a role play regarding a baby's discharge from accident emergency department after management of undisplaced fracture in collarbone, and the baby is with the arm sling. So they have so much concerns, so much worries, and so much doubts regarding the discharge plan, and we are getting the concern and answering for the mother. So we will start the card and discussion. So this is the role play card, and you can see that nurse's role is you see the patient of 4 years old who has been treated in the emergency department for an undisplaced fracture in the middle third of her clavicle. She has had a sling put on and is now ready to be discharged. You are giving the parent advice on aftercare and the healing process. The child is not present for the discussion. So this is exactly the scenario. You have to just imagine that you are in emergency department and you are approaching mother to discuss regarding baby's discharge plan. So what you have to do during the 3-minute preparation time, you have to just ask how may I address you and what I can call your baby. Example, if the patient name is Rose and mother name is Maria. And then we will start with the task. The first one, as I told you, it is starting with confirm. Reason for seeing the the parent. Advice on child's aftercare and healing process. Find out how parent feeling about child is going home. So how we can confirm. Good morning, Maria. How are you feeling? How is your baby doing today? You can start like that. Okay. Good morning, Maria. How is your baby doing now? Like that, you can ask, and we can tell that. Actually, I came here to discuss regarding your baby's discharge today. Is her doctor explained to you regarding the discharge plan? So that is a confirmation. Okay. Then mother is telling that, yes, sister, I know that she's getting today. Then we can tell that, actually, I can see that you are somewhat anxious regarding something. So if you don't mind, may I know the reason behind of your anxiety? And I would like to ask you that how you are feeling about your baby's discharge today. Like that, we can ask together. Then mother is telling that, yes, sister, actually I'm somewhat worried about getting baby's discharged, because still she is on arm sling, and really I don't know how to take care of the arm sling. Then we can give the reassurance. Maria, I can understand your concern. Being a mother, which will be really a difficult situation to handle the small baby with the arm sling, but no need to worry. I will explain you in detail regarding the post-discharge care. Like that, we can tell. Then what is the task is given? Give information about using of sling, like day and night, removal for bathing, extra pillow for arm support. Then recommend pain medication for first few days, like paracetamol or acetaminophen before bedtime, then as required. So how we can present? Well, Maria, I would like to tell you that this arm sling, actually your baby is required to wear 24 hours day and night, and please remove the arm sling only for bathing, only at bathing time. And when she is sleeping or when she is taking rest, you can provide extra pillows for arm support. So how does that sound? Then she can tell that, okay, sister, I can do that, I will try for that. Then we can tell that, of course, your baby maybe will be on pain for first few days. For that, you can give her paracetamol or acetaminophen syrup, which will be instructed by your pharmacist upon your baby's discharge. And please give this syrup before bedtime, then whenever necessary. Is it okay for you? Like that, we can ask. Then the next one, suggest ways of encouraging child sling use, customization, decoration, sling on soft toys, etc. Then advise on cessation of sling use. That is usually 3 to 6 weeks. Then fracture site pain-free, ability to move shoulder or arms. Then we can ask the mother, do you have any other concern? Then maybe mother is asking that, sister, really I am concerning about the usage of arm sling, because I know that my baby will not use this type of assistive devices and all, because she's still small. Then we can tell that, of course, Maria, I can truly understand your concern, as your baby is very small, and of course she will refuse for that. But I can give you some suggestions. That means you can customize or you can decorate the arm sling for your baby. And if you can make a sling for your baby's soft toys, like elephants or whatever her of course she will have some soft toys at home, right? You can make arm sling for those toys, so at least she can have a fun time with them, and she can wear that too. How does that sound? Or is it okay for you? Like that, we can ask. Then the advice, next one is that, Maria, for information, I would like to tell you that this sling is necessary for your baby to wear for maximum 3 to 6 weeks, until the fracture site pain is relieved completely, and when your baby can move her shoulder or arm freely without any pain. So please keep it in your mind. Then the next one is stress importance of no rough play for 8 to 12 weeks after sling removal, like bones still weak, fragile, risk for further fracture, etc., and find out questions or concern. Then we can ask whether you have any other concern. Then maybe mother is telling that, what about a play, because she is keen to play with her siblings, something like that. Then you can tell that, yes, my dear, it is important for your baby to avoid rough play for 8 to 12 weeks after the sling removal, because still her bones will be weak and fragile, and there is risk for further fracture also. So I am strongly recommending you to restrict her from the rough plays. Instead, she can play like indoor plays instead of outdoor plays. Then we can ask any other concerns, any more concerns, or you have anything to be clarified. Then maybe she's asking emphasize follow-up appointment. She's asking that when I can get her baby back into hospital. Then you can tell that I'm appreciating your concern, Miss Maria. Actually, there is no follow-up appointment is recommended unnecessarily for this displaced fracture, because this is a and this is an undisplaced fracture, so there is no supervision or intervention is required after discharge. Usually if there is no complication, I hope there will not be a not more complication during the post discharge period, but I'm advising you to get doctor's attention in case of pain on fracture site after 6 weeks, and if there is any constant pins and needle sensation for her in the affected part. So how does that sound? Here you can ask, are you following me, or is it clear for you? Like that we can ask, not how does that sound. You can ask, is it clear for you? Okay, then we can tell that do you have any more concerns? Then she's telling I don't have any other concern, and we can wind up. Okay, Miss Maria, I hope I have clarified all your doubts, and if you have any doubts at any time, please do not hesitate to contact me. I will be in the nursing station, and let me proceed with your baby's discharge process. So that is the conclusion, because this is a discharge plan discussion. After this discussion, we are going to start the discharge process. So this is a scenario, and this scenario usually you will get it like first role play, or sometimes second role play also in it, because second role play means there will be more content. If it is short content, it will be for first role play. And the important thing you have to keep it in your mind here, you are talking to mother, not to the patient. So always when you are giving the advice, take care, because this is a second degree talk. It is essential for your baby to restrict any rough play, or it is beneficial for your baby to use Sling for 24 hours. So in this way you have to continue, and don't make your baby's mother as a patient. So sometimes when we will talk casually, it's like in simple way we will tell it is essential for you. So that is incorrect. And at the end, most of the students used to tell that I wish you speedy recovery for your baby. No, not like that. I wish her speedy recovery. So that is the thing. Okay, so if you want to tell like that, means you can tell I wish her a speedy recovery. So if you are telling I wish you, means the patient, the mother became the patient. So like these and all very simple points, but if you make simple mistakes, many mistakes, means it will affect your score. You will not get B score. So take care when you are preparing and when you are presenting. So at the time of preparation, you can just underline the important things, and you can write mother's name and baby's name. And if you are confused with are you following these connectives, like are you following me, is it okay for you, am I clear for you, these things and all, means you can just write it in the right side of your role play card, like a small sentence. So you will not give multiple connectives in the, I mean the repetition can be avoided if you are doing like that. Okay, so I hope this role play discussion is clear for you. Just try to follow all these criteria and small tips what I told you. I hope you can do very well for your exam. So during preparation time, you can use all these tips, and if you need some more role play cards, like exam oriented role play cards, just join with my Telegram group, and the link is given in the description. And you can go to my playlist also in the YouTube channel. In that I have given separate playlist for reading, I mean writing, and even under writing there are more like a playlist for doctors and for nurses, and referral letters separately, non-cases letters separately for the dietitian, physiotherapist, occupational therapist, music therapist, dietitian, pharmacist. Even there is more tips. Even there is separate folder for the tips also, and there is introspection separate. So many playlists are there in my YouTube channel. So just go through that so that you will have time to see each and everything, like in everything in different platforms. So I hope it will be easy for you. And if you have any doubts, just message me in the YouTube or in the comment box or in the Telegram group. I can help you with whatever your questions with writing and speaking. Okay, so thank you for watching, and we will see with another one informative video. Until then, bye, take care.